after a record-breaking COVID surge, of course, driven by that Omicron variant. Rhode Island is finally starting to see some much-needed relief.
COVID trends are improving, so that's good news. Medical teams deployed by the federal government still hard at work providing support at the state's hospitals. KAYLA Fish joining us live this morning with the very latest. KAYLA.
Hey, good morning, Patrick and Danielle. Well, the latest data from the Department of Health shows declines in daily cases, weekly hospital admissions, and community transmission rates. Despite that, hundreds of people are still testing positive each day, and the latest data shows that 10 more people have died with COVID in the state. Health experts say people shouldn't let their guards down and continue urging people to wear high-quality masks and get boosted. Only about a third of Rhode Islanders have actually received their booster shot. As of Monday, there were 460 people hospitalized with COVID in the state. And last week, a military medical team arrived to provide some much-needed relief at Rhode Island Hospital. They'll be here for 30 days. And Mark Pappas, the state's chief COVID administrator, told a Senate Oversight Committee this week that they could be staying even longer.
There is an extension process that we're looking at now as a team to make sure that we can try to keep those teams a little longer, as long as we can in place.
Now, a spokesperson for Lifespan tells 12 News that we'll be getting an update on how things are going with the FEMA team here at Rhode Island Hospital. That's happening sometime this morning. Now, we're also getting a glimpse at what the next few weeks and months will look like in terms of the pandemic. We'll have more on that coming up in the next half hour. In the meantime, you can find the latest COVID data right now on our website, WPRI.com. Live in Providence this morning, I'm KAYLA Fish, 12 News.
As COVID trends are improving in Rhode Island and other parts of the country right now, a lot of people are starting to look toward what is next.
Health experts weighing in, painting a picture of what to expect. 12 News reporter KAYLA Fish live outside of Rhode Island Hospital this morning, where we'll be getting an update later this morning. Right, KAYLA?
Yeah, that's right, Patrick. A medical team from FEMA has been working here at Rhode Island Hospital since last week, and we're expecting to get an update on how things are going inside the hospital later this morning. Now, the team that's here has been providing really some much needed relief as the state starts to see improvements in terms of COVID trends. Dr. Ashish Jha of Brown University says we're in a transition moment in the pandemic as cases begin to decline following the worst surge in infections we've ever seen. He says over the next few weeks and months, we should start to see a reprieve because of high levels of population immunity, both from infections and vaccines and booster shots. Dr. Jha says that could lead to some relaxed restrictions, like in terms of mask mandates, but it should also be a time to prepare. Planning for the future is something Rhode Island is already doing. Mark Pappas, the state's chief COVID administrator, said this week that they put together a team to focus on just that.
Put together an all-of-government team to look at future operations and how we can solve these problems quicker and be ready when these things hit us out of the blue, as they have shown themselves to do. So we look forward to seeing how that team can help us be ready in the future for whatever comes our way.
Now, Dr. Jha also suggested that the federal government use the expected reprieve in terms of COVID to stock up on things like masks and tests. He also suggests possibly developing some new COVID vaccines. In fact, Pfizer announced this week that it has already started testing a new vaccine that targets the Omicron variant specifically. We're live in Providence this morning. I'm KAYLA Fish, 12 News.